Well, I think it'll be commonplace 10 years from now. If you have reasonably good health and you have a total knee or total hip, it'll be done in a completely outpatient setting. Spine is not really my level of expertise, but I think many cervical disc infusions and standard lumbar cases, including some fusions, may be done as an outpatient surgery. As new procedures are done in outpatient settings, there is a little bit of a learning curve, and there are certainly things that are easy to accomplish and things that are harder to accomplish. So I would say do something that you know is going to work. Get a few wins under your belt for your staff morale, and so you can kind of test the waters before you venture into other things. Make sure you're well prepared, those around you are well prepared, and basically plan for the worst. Make sure that your follow-up care, if there's a rehab stay involved, make sure that all that is seamless and lined up before it comes to the launch day. There's lots of minefields out there. The legislation behind it is terribly complex, and it's always changing. And then you've got employment laws and workers' comp and all those things. And I think particularly a corporate partner that has a wide footprint, say historical experience and geographic and legislative experience, I think all that brings a lot to the table. Operationally, there are some, obviously if the partner takes over operational day-to-day management, either in conjunction with the physician team or completely takes it over. I think that lets the physicians practice medicine and worry less about the day-to-day issues, the hiring and the firing and the other things that go with the HR department. I think as far as what a corporate partner brings to the table, particularly in our specific situation here, it was access to capital, it was access to strategic thinking from a partner that we shared common interest in and common goals with, that had been through the process before, not just regionally but nationally. I believe we've been associated with AMSURG for around 14 years now, and it's been very positive. Particularly at the outset, they were very helpful in getting us up started and running. AMSURG has been very, very good at tracking data within their centers and comparing that to available data nationally. For example, pharmaceutical errors, wrong site surgery errors, slips and falls in the OR, things like that. We're benchmarked our center to every other AMSURG center. We can compare that data. We compare our data on costing, what it costs for a suture anchor from this company here versus a suture anchor from the same company in California. And all that is very, very useful as we negotiate contracts and really see where we stand. Are we as good as we think we are relative to other AMSURG centers and other facilities in the country? So I think AMSURG has been very useful, that data that we wouldn't otherwise be able to get. So it's been a positive experience for us.